Good day, everybody. I am Dr. Tanya Gale, and I'll be presenting a paper entitled Training is an Important Factor for Community Health Workers in Performing KOSPEN Health Screening Activities. Community health workers, or better known as volunteer health workers, are workers who are trained but do not have a professional certificate. The Ministry of Health Malaysia initiated Community Sehat Pembina Negara, or better known as KOSPEN, in October 2013. It is a community-based intervention program. In this program, CHW's main task is to conduct non-communicable diseases risk factor screening. This paper, therefore, aimed to determine the factors associated with not performing health screening activities by KOSPEN volunteers. Data from the evaluation of the implementation of KOSPEN program in Malaysia 2016 was used. It is a cross-sectional study which was carried out in randomly selected KOSPEN localities throughout Malaysia. Logistic regression analysis was applied to determine factors associated with not performing KOSPEN screening activities by the volunteers. Data analysis was performed using SPSS version 20. The results? These are the characteristics of volunteers by sex. As we can see, females were almost double compared to the males. Characteristics of volunteers by marital status. As we can see in the graph, there are 563 married volunteers compared to 134 single, divorcee, widower or widowers. Characteristics of volunteers by education. As we can see from the graph, most of the volunteers were secondary school educated. Multivariate logistic regression showed that volunteers who never attended training and who felt the content of the training module was inadequate were more likely not to perform screening activities in the community. Volunteers or community health workers have been widely recognized to help in reducing the burden of NCDs in their communities. However, they need to be sufficiently trained. In our study, we found that training component as an important factor in determining if the volunteers would conduct health screening activities in their community. Attendance of training and the module content were key factors in determining performance of screening activities. Another motivating factor that was reported by a number of studies was remuneration for these volunteers. Various studies have shown that salary or remuneration given to the volunteers made them feel appreciated and encouraged them to continue serving their community. However, this study did not explore this aspect. In conclusion, attendance of training should be a prerequisite to qualify as a volunteer. Improvement to the training module should be made to increase comprehensibility of the modules. This paper was published in the International Journal of Public Health Research on the 1st of September 2021 and listed are the co-authors. These are the references used for the paper. Thank you everyone for your attention.